I rise to offer my no vote explanation to the Senate Bill 133. When this bill first passed the Senate, I expressed my concerns with this budget and, in particular, the detrimental cuts to the Department of Health and Human Services. Sadly, a month later, as this bill comes out of conference today, a majority of these issues still remain. Michigan citizens, especially our most vulnerable, kids, low-income families, and seniors, depend on these programs and services to survive. Going against the governor's recommendation, this budget moves forward with the closure of the W.J. Maxey Boys Training School. The W.J. Maxey facility offers intensive rehabilitation for delinquent male youths, including intensive mental health treatment, educational program, substance abuse counseling, restorative justice, and many more. 40% of the youths in public facilities like Maxey have already been kicked out of private facility. Closing Maxey increases the likelihood that these young men will end up being placed in out-of-state facilities, on the streets, or in adult prisons. This means that instead of helping rehabilitate and redeem these troubled young men, closing Maxey increases the likelihood that these young men will end up being placed in out-of-state facilities, on the streets, or in adult prisons. This means that instead of helping rehabilitate and redeem these troubled young men, this budget is putting their safety in danger and jeopardizing our communities. This budget also takes $300 in vital taxpayer dollars and dedicates it to unnecessary family independence program, drug testing pilot program. With so many other important areas in the budget being cut, we should not be spending these valuable resources on political grandstanding that has proven ineffective elsewhere. The states that already do this are spending a lot of money to filter out very few drug users. Furthermore, taking assistance away from a family that doesn't help get people into treatment programs. It punishes children for the actions of their parents or grandparents or guardians, and it doesn't do anything to solve the underlying problem. Instead of wasting money on a program that doesn't work, let's use that money on various other priorities to help parents and children. This budget also contains the misguided policies of reducing the important Department of Human Services field staff and closing offices at times when the public assistance caseload to worker ratio is around 800 to 1. In this bill, 233 DHS positions are being eliminated. Last month, my colleagues and I sought to restore the 100 DHS field staff positions that the department laid off earlier in the year, but that amendments were defeated along party line. With our citizens in need and our workers ridiculously overburdened, we should be increasing staff, not the other way around. Instead of cutting DHS staff, we should be ensuring that the people we represent are getting the services they need. These are some of the main concerns with the general omnibus budget before us, but they only represent one department. Mr. President, this is why I'm voting no and why I oppose this budget. And I would ask that my remarks be printed in today's journal. Thank you.